good morning, and thank you all for the opportunity to be with you all. If I am allowed, I do have some slides to share with you all to give you some updates, both in terms of our case numbers as well as our vaccine rates. All right, so the marker you're looking at now, there should be, okay, an Excel spreadsheet. And we're looking at our new cases. We've spent the last few briefings talking mainly, or at least the last several months, talking about vaccine rates due to the improvements in our community transmission levels. However, as I've referenced in the daily case reports that I send to you all, we are concerned about the upward trends of our numbers of new cases. And so I wanted to break down some of those numbers for you all by race, zip code, as well as by age, hospitalization, as well as comment on the number of breakthrough cases we've seen in those who've been fully vaccinated. So I'll walk through this Excel spreadsheet and pivot over to talk about our vaccine numbers. So this actually shows you the number of new cases in the last month. The last month up until the 25th, we've had 608 new total cases. And you can see how it breaks down in terms of the raw number of cases each week, as well as the percentage of cases. This particular section of the spreadsheet shows it broken down by race and ethnicity. And when we look at the total for the last month, 26% of our new cases are non-Hispanic white, 17% non-Hispanic black, 2.5% non-Hispanic Asian, and 15.6% Hispanic, other 14, and then we still have about 24% missing data on that. When we look at zip code, here are the number of new cases broken down by the zip codes within the county respectively. We see, looking at the total at the bottom, the highest percentage, I believe it by zip code, 6.6%, which is the highest percent of new cases. Highest percentage of new cases within a zip code in the 20904. It looks like the next one is 5.6% in 20902. And there are a couple that are at 4%, 20878 and 20906. When we break this down, and again, I will send this to you all following the presentation. When we break this down, new cases by age, when we look at the total here at the bottom, you can see 11% of the cases are 0 to 9, and this is important because this group is not eligible to be vaccinated. 10 to 19, 12%. But we start to see the higher percentage of new cases within our 20 to 40-year-old populations, 20% 20 to 29 years of age, and 15.8% those are 30 to 39. And this is concerning because obviously these individuals are eligible to be vaccinated, and yet we're continuing to see a higher percentage of that group being our new cases. When we look at the hospitalizations for the confirmed cases during this time period, as I told you, 608 new cases in the last month. 32 of those individuals have been hospitalized, which is just shy of 6% of new cases. And here's how it breaks down by race and ethnicity for those hospitalized cases. And again, a similar measure that looks at the hospitalizations by zip code and hospitalizations by age. We know that, as we've seen throughout the pandemic, older populations have been more susceptible to having adverse reactions and complicated courses, and this plays out when we look at of those 32 cases, 10 of those, or 30%, have been 60 to 69 years of age, and another 9%, those 70 to 79. But what's important to point out is that we also see 15% for 20 to 29-year-olds and 15% for 30 to 39-year-olds, which suggests, again, that this is not something completely innocuous if younger people do contract COVID. They, just as we see in other groups, are susceptible, particularly with the variants, of having complicated courses and requiring hospitalizations. Now, the last thing I wanted to point out in terms of new cases is the question of breakthrough vaccines. Breakthrough cases in the individuals who've been vaccinated. And we looked at the 608 cases in the last month, and we were able to get vaccination data for about 32% of those individuals. And we found in that population that we had approximately 144 individuals who had received 2 doses of the vaccine. Of those 608 who had cases, which is about 23%, and 139 of those had been outside of the 14-day window, and another 4 had not received their second, or I'm sorry, had not completed that 2-week window after receiving the second dose. Now, this is important to point out because there's 2 ways you can put numbers out. I know the governor's office tweeted something last week to talk about the number of breakthrough cases. So we're looking at 144 individuals out of the nearly 800,000 folks we fully vaccinated in our county. So when you do the math, you take 144 divided by the 800,000 folks who've been fully vaccinated, versus when you just look simply at the number of new cases, what percentage of those who have been fully vaccinated. It's important to note and to continue to emphasize is that vaccination provides protection. There is a small risk that you could still contract COVID, but individuals who are fully vaccinated are not showing up in the hospitals, they're not our fatalities, they're not experiencing symptoms, and they're not experiencing significant illness. Conversely, when we look at the unvaccinated population, they are overwhelmingly all of our hospitalizations, and overwhelmingly, I believe in the month of June, 100% of the COVID-related fatalities. Just want to make sure that folks understand the difference between those different groups. Now, I would like to pivot to share one other set of data here. When we talk about our vaccine rates, just quickly, this is just a map to show the case rates by county. As you know, we were well below 1 for the last month, and that number has creeped up to, I think today it was actually 4.5. And you can see how the numbers are increasing across the state. And then this shows you the daily percentage of those 70% cases. The percent of new cases who are not fully vaccinated. And so we're still seeing almost 80% of our new cases across the state not fully vaccinated. And then when we look at our measures in terms of the percentage of folks we've covered, we again continue to lead the nation in terms of percentage of our population vaccinated who's eligible. The CDC estimate actually has us over 77% of the total population having received at least 1 dose, and 70% having received both doses. And again, this is for the entire population. When you look at those who are eligible, being those who are 12 and over the age of 12, we're well over 80%. And this again shows some continued focus in areas where we see some gaps in vaccine by geography and race and ethnicity. And then this is a map that shows you how different counties across the country in terms of the percentage of their residents vaccinated. And you can see we are, the red areas highlight areas where there are significant gaps in terms of the percentage of folks who are vaccinated in much lower percentages. And it unfortunately also correlates very closely to where we're seeing significant upticks of new cases as the Delta variant becomes or continues to be the predominant strain impacting our communities. So those are some things I just wanted to put out there in terms of our community transmission levels as well as our vaccine status. As again, we have talked about and I've shared with you all in our daily case counts, it is concerning from the public health perspective that we are continuing to see the upward trends in our numbers of new cases as the vaccine rate has slowed down. We've We've talked about the need to at least have contingency plans to discuss what would happen and what would the necessary measures be to consider taking further action. From the public health perspective, we've been clear in support that unvaccinated individuals should continue to wear face coverings. As the number of cases increase and community transmission levels increase, we also would be in support of considering other options to mitigate transmission as much as possible. And we would welcome and encourage a discussion about potential contingency measures related to that, as well as looking at different measures, including community transmission, case rates, hospitalization rates, as well as factoring in the percentage of our residents who have been fully vaccinated to provide additional protection. This is of increasing importance as we continue to open up society at full capacity, and we continue to move forward and hopefully get all of our students back into schools within the next several weeks. I know that the Board of Education will be meeting this afternoon to discuss what actions they will take in terms of their requirements, particularly related to face coverings and other issues as they move forward to put forward their policy for school reopening. I think that concludes my prepared remarks. Happy to answer any questions. We continue to be encouraged by our residents in terms of them taking actions to keep themselves and their families safe. For any individuals who are not vaccinated, we continue to encourage and implore you to get vaccinated to not only protect yourself, but to protect your family and allow us as a community to drive down community transmission as much as possible so that we can safely move forward in reopening all aspects of our society. The last thing I would say is, again, as always, it's summertime. Please continue to practice safe practices in terms of the activities that you are participating in. Make sure that you stay hydrated with the extreme heat and temperatures that we're experiencing, and continue to check on your relatives and other family members or community members, particularly older folk within the heat, to make sure that they have the necessary provisions to stay safe and are connected. Thank you.
Dr. Stoddard, congrats on your new job.
Thank you. I appreciate it. Just a couple of additional comments to what Dr. Gale said, and I think just to largely reflect that I absolutely agree with his assessment that obviously we need to be monitoring very closely our conditions. And I think one thing that we are paying a lot of attention to is we have seen a decoupling to a degree of cases from hospitalizations across the country with vaccination rates, and our vaccination rate in Montgomery County is among the best. And so obviously, we can't ignore case counts as they keep going up, but obviously we also are paying a lot of attention to that hospitalization rate. And if we start to see an uptick there, I think is, where we're going to really start to raise the alarm bells, just for the council's benefit as the Board of Health, around, having to take some additional further actions. If cases continue to go up at this rate, then we may need to consider those things. If hospitalizations go up as cases go up, we know hospitalization lags cases, and so it's something we need to pay attention to. So I guess the summary of that is we can't let cases go up forever, even if hospitalizations don't go up. But if hospitalizations and cases go up, that's a real alarm bell that you all should pay a lot of attention to. And I think we've discussed having some potential benchmarks where we would request that the Board of Health return and discuss potential additional actions. And I think I think Dr. Gales was working on those, and I'm sure we'll be able to share those as we move forward. But obviously, we're incredibly enthusiastic about the levels of vaccination we've achieved. We have seen many calls, though, from the unvaccinated. I've seen several, certainly on social media and others, commenting about their, people who are hesitant now have seen what Delta can do and are, those people are coming forward and getting vaccinated, which is great. We encourage anyone who has not been vaccinated in Montgomery County to please do so. You getting vaccinated now gives us the best chance to have a successful school year, to not see the case rates increase that we see across the country, and all of that. So that's all I have this morning. I will note, at least on the rental relief program, we did make the $2 million for a single week mark last week. That was a target that we had set for ourselves. As you'll remember, several weeks ago, we were only doing about 1 million a week. We got to 2 million last week, which is a great increase. We're continuing to try and work to do more and faster. But I wanted to provide that one update because I know that the council has been very interested in the rental relief program as well. So I will stop there.
Thank you, Dr. Stoddard. And I should clarify that we're so glad you're staying in county government and been nominated to be an assistant county administrative officer. So we're very eager to continue your good work with us. Just one quick follow-up question I had, Dr. Gales. I'm glad to hear you mentioned that you're open to other measures beyond masking to mitigate the risk that's posed by unvaccinated residents and visitors. In your view, should individuals over 12 who have refused to get vaccinated at this point lose any privileges at some point, such as the ability to enter indoor public spaces, particularly county facilities? Should we be asking residents to show their vaccination card or use a passport system like other jurisdictions have thought about?
I can't comment on that in terms of, I don't make those policies, but what I would say is I would provide guidance to you all and to others in terms of the potential value of those steps. I think that there are a host of measures in terms of potential things in the toolbox, including one measure would be looking at, other jurisdictions who have taken the step to re-implement mask mandates, particularly in indoor settings, regardless of vaccine status. You have seen other places. I believe the president of France introduced the idea and notion that you referenced about proof of vaccination in terms of, in order to participate in daily activities, going to restaurants, working out, going to schools, going to different activities, having to show some level of proof of vaccination. The challenge would be obviously is creating a system, particularly in the absence of a federal and a state system that allows for that, is creating a mechanism for that to happen. I think it's important to note that from my understanding, at least from a legal perspective, businesses retain the right to be able to do that now. If they do request individuals to demonstrate and show vaccine status in order to be able to enjoy the privileges of the services that they provide.
All right, good point. Thank you. Councilmember Reamer.
Thank you so much. Tough day with the memorial for our county employees today, and just the anxiety out there about the increase of cases related to the Delta variant. It's tough that we're continuing these challenging conversations, but we knew that this was not going to go away anytime soon, and the pandemic, in fact, is certain to be with us for a long time. So this is the new normal. But I am absolutely encouraged by the news that there are no hospitalizations among vaccinated residents. And given the very high level of vaccination for our 12 and up population, I think generally that, as I think Dr. Stoddard was kind of explaining, and Dr. Gales, that if there's no hospitalizations among vaccinated residents, then the threat that we're facing, broadly speaking, is a contained threat. And it requires targeted measures to address. And I think we need to do more with our targeted measures for the Delta variant, but at the same time, recognizing that unless something changes, vaccinated residents don't end up in the hospital. Almost everybody above certain age range is vaccinated, and so the ultimate health impact of this, we still have a very effective tool in vaccinations, and the risk is fairly low for those who are not vaccinated. It's those special circumstances if you have, for example, someone in your household who cannot get vaccinated. And you are vaccinated, of course, it's a big risk. If you were to contract it, you're not at risk yourself, but you could transmit it to someone in your household, for example. So it's important for us to continue to contain this. But I continue to wave the flag for incentives, and I know it didn't make it into this round of enhanced COVID emergency measures. But I have asked council staff to draft an appropriation for September. I think we've got to get deeper into these target zip codes and into targeted communities where there's access issues or hesitancy issues, and incentives are proven to work. And we need to, of course, continue to deepen our door-to-door and other kinds of grassroots activism to reach people. As far as masking is concerned, I will say I see a very high level of voluntary masking in the county. And I admit I haven't been inside a grocery store in every neighborhood of the county, but generally what I'm seeing is a very high level of voluntary masking. So, whatever that's based on, I believe the science that if you aren't vaccinated, if you are vaccinated, you don't need to mask. But obviously, if everyone does choose to mask, I think we're safer. So I see that working well. But I think a big open question is kids and schools and masking, which seems to me will need to be required. Vaccine mandates for kids when that's legal. From the state, I understand the state has to require that. And county employees, I'd very much like to see a mandate for county employees. That is an emerging best practice. And, the Veterans Administration has just put that in place. I think we'll see more governmental organizations, achieving that. We don't know enough, I guess, about our county employee vaccination rate. But I think a mandate, as a term of employment, or I'm not sure what the consequences need to be. I have to figure that out. But just seems like, from our perspective, we would want it to be required, and we would not want to have tolerance for people who are refusing to be vaccinated for any reason other than a doctor ordered health reason. I think there's a big open question about why should people who are willing to get vaccinated have to pay for the expenses of people who are refusing to get vaccinated when they go into the hospital. This is a national trend, frankly. But generally speaking, again, Dr. Gales, thank you for the information you shared about no known hospitalizations for people who have been vaccinated. I think that's a critical piece of data for us to keep front and center. Thank you.
If I could add to Councilmember Emmer's remarks to clarify, I did get confirmation that businesses can require proof of vaccination for entry of their services. The second component is that, yes, we are obviously continue to be excited and want to move forward, getting higher percentages of our residents vaccinated. But we're still talking about several 100,000 people who aren't covered. That's potential for several 100,000 individuals being susceptible to COVID that could potentially contribute to hospitalizations in the future. The other component that I want to highlight is that it's important to continue to drive community transmission levels down, because driving community transmission levels down also decreases the potential for interruptions to services. So, for example, if a person comes, test positive for COVID, if individuals have been around that individual without face coverings and other mitigating circumstances, that increases the number of folks to potentially have to quarantine again and to have to stop that particular service for a time period. This takes on added significance as well as in terms of school guidance related to spacing and wearing face coverings. So I just want people to also understand is that, one, we're trying to drive community transmission down as low as possible, again, to keep from having to interrupt businesses and interrupt services. None of us certainly none of us in public health want to have to get to a point where we'd have to recommend closures or things like that. We're just making sure that folks are mindful that we have to pay attention to the trends and look at some of our other tools that we have in the toolkit, again, to drive the number down as much as possible so that we don't have to see any of those other more stringent options be put forward as guidance to keep us safe.
Thank you. Councilmember Friedson?
Thank you. Thanks for the update. I think we've really started to hone in on, zip codes and age and specifically looking at these numbers. It's really helpful for us and really appreciate these regular updates here at this meeting and also your emails to us, and really appreciate that. I want to talk quickly about some of the suggestions that you've made and also pick up where Councilman Reamer was noting. Not only France, but New York City recently announced the percentages of their own employees, firefighters, police officers, paramedics, who are vaccinated. I was just wondering if we have that type of data or whether or not that is something that we are looking into and pursuing as a county government, looking at our first responders and county employees as a whole and determining what our vaccination rates are of our own employees, because we are an employer, a very large employer, and I think we can lead by the power of our example, not just the example of our power.
We have not engaged with our employees to try and assess vaccination rates across the entire government. I will note, though, that because we were the primary vaccinator during the time when public safety was being vaccinated, we were able to track public safety vaccinations more closely. And candidly, our numbers are substantially higher than those in New York City for our first responders. And I think that's probably exemplary of where our employee base is generally, given what we know the vaccination rates in Montgomery County are overall. That said, we certainly are following very closely both the changes that have been made in New York City and California to require employees to be vaccinated. The county executive has expressed an interest in having this conversation with our employee groups to see exactly what, how to roll that kind of program out. And I do expect that conversation will happen, particularly now as we're seeing more jurisdictions do it. So I don't think there's any opposition to that notionally. It's I'll be obviously finding an accord, and particularly as it relates to, as Councilmember Reamer referred to, figuring out the consequence or what the right agreed upon discipline process would be for someone, or accommodation or what have you. I don't want to forestall that it would be discipline necessarily. And then what exemptions would be appropriate. Medical exemptions obviously would be considered, but obviously we want to discuss with the employee groups exactly how this kind of process would work. I just was reiterating, I think from the policy perspective, I think there is real interest in working out the details of something like this, and I think that conversations around this will proceed.
Well, appreciate that. I strongly urge that we move in that direction. I think we talk a lot about our residents leading the country and eligible being vaccinated, and that percentage of large jurisdictions. I think it's important that we demonstrate that our county government is a leader in the nation when it comes to stepping up and doing what is needed to keep each other safe. So I think moving in that direction and requiring that, working with partners to make that happen and to operationalize that would be a positive step in the right direction. And I think sooner rather than later, getting that data and publishing that for ourselves to hold each other accountable, and then also for the public to know. I think that's really important. I'm confident that we will be doing better than most, but that there is still more work that can be done in that regard. And so I think it would help to hold us accountable. And my understanding, the Department of Justice, not only for businesses, but also for agencies, including local governments, that requirements for vaccinations. There's no federal laws that are preventing that. That was an open question for quite a bit of time based on the authorization. That doesn't seem to be an issue now. So I appreciate that. But the last thing that I will say is that I do think continuing to monitor this is important and figuring out where we head. I am a little bit concerned that we not punish or impose restrictions on those who have been vaccinated, that we try to target additional restrictions or changes on those who haven't been vaccinated in order to try to continue to move as many folks as possible to be vaccinated. I think that was the direction that we headed with our final health orders with your significant advice and input. And I hope that we continue with that trend and with that effort. So thanks for all your efforts and your continued work. Look forward to continuing the conversation, and very eager to see the results of the conversations with the labor partners, particularly about what those percentages are and how we're going to move them in an even more positive direction. Thanks.
Thank you. Council Vice President Albornoz.
Thank you, Mr. President. Thank you again, Dr. Gales, Dr. Stoddard, the whole team. The fact that we lead the country in this really critically important category is just a testament, once again, to everybody's dedication and hard work and, frankly, innovation. So it is, and all the folks that are going to Home Depots right now, to creative places, supermarkets, where vaccinations are being stood up. Wherever folks are is I think a testament to the folks that are out there, particularly our minority health initiatives and program that are doing such incredible work. So this is all overall good news here in Montgomery County. I wanted to just summarize really quick, Dr. Gales, just to make sure I understood kind of where we are in your recommendations for myself. So bottom line is, at the moment, community spread continues to be low, especially relative to the rest of the country. Hospitalization rates continue to be low, especially as it relates to the rest of the country. So at this point, you're not formally recommending that we enact policies such as mask use at this specific time, with the acknowledgement that we have to continue to monitor these numbers, and at such time, re-implement, for example, the mask mandate indoors. I just want to be crystal clear on where we are with this, so that we can prepare accordingly. And for our public at home, although we are going on recess after this week, as has always been the case, we stand ready to convene as necessary to implement policy, sitting as the Board of Health. But I think that's what you said, but I just wanted to be sure about that.
Thank you, Councilmember Albornoz, for your question. So let me be clear so there's no confusion. From a health perspective, what we're requesting or asking is that there be a plan put into place that comes up with metrics and measures that would trigger potential action to take next steps. And that includes, having a conversation about what those metrics would be. Similar to back in the fall when we talked about looking at metrics for potential closure of activities if we saw an increase in cases, as well as what types of measures would be put into place to trigger reopening things, such as we put into place back in April related to vaccine numbers. My attempt to put forward this guidance is to ring an alarm, to sound an alarm, to say the numbers that, while they are on the lower end, are not moving in the right direction. Now, again, we are in a different place where we were in the fall, given that we have a high percentage of our residents vaccinated. We still have several 100,000 folks who are not covered within that, including our children. And it takes added importance in terms of having contingency plans in place, because we know that within the next several weeks, our kids will be back in school. Businesses will continue to reopen again at fuller capacities, bringing folks back into offices. So we want to make sure that we're mindful of those types of activities, because again, we want things to move forward, but we want them to move forward safely. And so what we're asking is that, given that the numbers are moving in, they are increasing, certainly they have increased over the last several weeks, this is an effort to ring the alarm and sound the alarm to make sure that we have done our due diligence in having those discussions, to have contingency plans in place, so that we're not having the discussion, God forbid, that we do see those hospitalizations increase, in that setting, because we know that historically putting in those measures before the numbers get worse do have an effect in terms of mitigating it. And I want to just also be careful about how we couch this, in terms of, if if there was a recommendation or a movement to re-implement a face covering mandate, I don't, at least from the health perspective, don't want to use terms in terms of, punishing those versus, vaccinated versus unvaccinated. Because at the end of the day, these are efforts to keep people safe. And so I strongly implore folks who are not vaccinated to get vaccinated, because vaccines are our most effective tool in the toolbox, because we know they work and they keep people from getting sick. And the higher percentage of those folks we can get covered, the less we have to be concerned about putting in these other mitigating factors or other mitigating tools to keep people safe. So I hope that answers your question.
It does. So I think if I'm hearing you correctly, we should probably reinstitute the meetings that had occurred more regularly between council and executive staff, just so that we're not flat-footed as we continue to monitor the numbers. And fortunately, there's a game plan. I mean, we've been through this several times now in terms of waves, so we know what those benchmarks are generally. They're not perfect, but generally. So I think we'll revisit those as necessary, and hopefully between now and when we come back in September, we won't have to. But as you said, it would be prudent for us to be prepared just in case. So I will follow up with you, Mr. Council President, so we can recommend and make sure that my colleagues all have the opportunity to weigh in on these discussions as we get weekly updates. Two final questions for now. It's just absolutely infuriating that there are certain states in this country that, for political reasons primarily, just refuse to follow the most common sense aspects of the science. Florida being one of those states. And as we know, it's a popular destination for vacationers. There are a number of county residents that own properties in Florida. Could you advise us a little bit, given the circumstances that we're seeing in Florida, is the state looking at or exploring recommending that people coming from these states, as we've done in the past, that have higher rates of spread, quarantine when they come back?
Well, I'm not sure if the state is planning to take action on that. I have not received any intel or had that be a part of any recent conversations that I've been a part of. But that does introduce, again, another tool in the toolkit that we could potentially explore as a county in terms of identify, much like back in probably about a year ago, where there were travel restrictions put into place based upon certain jurisdictions that had high levels of cases. And so again, those are parts of the conversation, again, in terms of having contingency plans to keep our residents safe. And that would be one option to explore in terms of potential testing requirements tied to some of those higher volume places, because it is extremely concerning that a place such as Florida, high population, lower vaccine rates, where the variants can spread very quickly. And then individuals traveling to those places could bring those home. So what I would say is similar to what we talked about last year, is that individuals be mindful of the places where they're going in terms of looking at what the community transmission levels are. If and when you do travel to those places, particularly given that have high levels, is continuing to double down on the guidance that we've shared in terms of wearing face coverings and washing your hands and cleaning surfaces and those types of things, and being very mindful about your level of exposure to others, particularly related to physical distancing and those types of principles. And quite frankly, would recommend individuals getting tested when they return home to know what their status is, to make sure that they've not picked up COVID and brought it back to their homes and their schools and their businesses as they return after their vacations or time away.
And Council Vice President Albanos, just to add to Dr. Gales, he indicated and has reemphasized not only vaccination, but testing. We have testing available. So all who are viewing the council sitting as the Board of Health, we have testing available Monday through Sunday from 9 o'clock to 6 p.m. And then on Tuesdays and Thursdays, our mobile vaccination team with support from the state is testing at our the American Grocery Store in Piney Branch from 1 to 7. We have testing available, and we still continue to, upon request, have home-based testing. Individuals can call 240-777-2982 as a reminder. And I wanted to share that information again, because as individuals travel through the summer to those areas that Dr. Gales indicated on that map that have had higher rates of community transmission, we strongly recommend and encourage you to get tested, know your status, and if necessary, quarantine or isolate accordingly.
Thank you. I think Dr. Stoddard, you were going to say something.
Yeah, I was going to just chime in concert with what we've just heard. Last week, 40% of the cases across the country were in 3 states: Florida, Texas, Missouri. So if you're traveling to one of those 3 states particularly, but not exclusively, you absolutely should be considering testing upon return and masking while you're there, limiting your, times. I certainly wouldn't do, for example, indoor dining in one of those 3 states right now. If I were, particularly if you have children that you're traveling with, often parents are traveling with children at this time. So just be smart about where you select to travel. If you travel to those places, be smart when you get there, and be smart, particularly when you get back, for the benefit of everyone in Montgomery County.
Wow, that's powerful and important message. Final question. So obviously we're all hoping that the vaccine becomes available to children under the age of 12 as soon as possible. And none of us have can predict exactly when that's going to happen. But Dr. Gales, just to reaffirm, you've talked about this in the past, but particularly for families who are, the moment it's available, are going to want to get their kids vaccinated. I assume, and just want to confirm, the infrastructure is still in place for us to churn that out quickly. And that although we've closed some mass vaccination sites, we still have all that we need to be able to implement something and turn it around and within a reasonable amount of time, get vaccinations in kids' arms.
Sure. So yes, the infrastructure remains in place, but hopefully also in addition to the mass vax infrastructure, is there have been significant conversations at the state level to talk about improvements in terms of getting the vaccine available to private providers as well, making it more readily accessible to community providers. One of the blips that was experienced when we had the 12 to 18-year-olds become eligible was that there were some issues with getting the vaccine from the federal level to providers directly, and hopefully those challenges in the system have been ironed out. I know that we had our the state immunization committee meeting, which I chair, last week, and we talked through those particular issues and have brought that to the attention of MDH. So the short answer is yes, we do retain that infrastructure, but we are also hopeful that the vaccine will be more readily available to community providers to offer some diversity and increased points of access for families.
Great, thank you. Yield back to you, Mr. President.
Thank you. Councilmember Jawando.
Thank you, Mr. President, and thank you, as always, Dr. Gales, Dr. Stoddard, Dr. Bridges, and your entire teams for all the work you're doing. Also want to just send my heartfelt condolences to the families of all those that we've lost, but especially in this moment this morning, our brave men and women who've passed through this pandemic during the last several months. It's really a stark reminder of how serious this is. Couple questions as follow-up. I appreciate my colleagues' questions up to this point. When you say metrics or measures, Dr. Gales, do you have suggestions, right? Because I think, even though we're the Board of Health, we have appropriately leaned on your guidance and your team's guidance to set what we think those metrics and measures should be. Have you all gotten to the point where you're looking at what that might be? Because they're going to be different, right? You've said we have a lot of people vaccinated, so the measures, likely need to be a little different, or maybe they don't. That's kind of a question. What would be in your mind, have you started to formulate that? And vis-a-vis a place like Los Angeles or something, it's kind of a secondary question. Are we looking to what others have? I know they're a different situation, but they obviously made their decision based on some set of data. So could you just provide a little more insight into that?
Sure. Thank you, Councilmember Jawando. So the first answer is yes, we are continuing to look at what other jurisdictions are doing, not only across the nation, but we've been engaged in conversation with health officers across the DMV region as well as the state to talk about what other places are doing. And it seems to be kind of a consensus that recognizing the trends, folks are, looking at contingency plans, and in particular, focused interventions versus, kind of broader population interventions. And some of the measures that would be, looked at in consideration are, the ones we've looked at historically, community transmission as evidenced by case rates, and looking at not only the raw numbers, but also the change. So for example, when we look at our daily cases reported, we've seen a 75% increase over the last week in terms of cases reported on a daily basis. So looking at the raw numbers, looking at the percentage of change, also again, looking at the hospitalization numbers, because that gives us also a sense of the severity of illness that folks are experiencing. And so, looking at the percentage of beds in use, as well as the percentage of those beds being occupied by COVID patients. And so we would look at that raw number, again, percentage, but we'd also be keen to look at and try to identify an upward trend as quickly as possible. So looking at, if there's a significant percentage increase in the number of people hospitalized, as well as, hospitalized related to COVID, that would sound an alarm, because as was pointed out earlier, and we've seen historically throughout the pandemic, the hospitalizations typically lag at least a week or so. The increase in the increase in raw cases and the hospitalizations typically lag and trail behind that. And we try to offset and cut this off as quickly as we can, so that we don't see that number balloon.
Great. All right. Well, I know we'll follow up with you, as Councilmember Alvarez suggested, more regularly to track those numbers. But if you could, you don't have to do it right this moment, but I think we should have you suggest to us what those trigger points should be, and what they should trigger, right? For example, I was at a large gathering event yesterday indoors. I'm vaccinated months now. I still wear my face covering indoors at large events where I don't know people's vaccination status. I have 4 children under 12, as does Councilmember Alvarez and others. And, and I have seniors, and, so we have, for my situation. And that is, for example, something that I think I'm seeing more of. People do voluntarily, but I do think that this in public places masking is obviously on the table. It could be tied to large gatherings. I think, I'm assuming those are some of the things you would look at as far as like triggers to, again, balance, allowing people to move freely, but balancing the health risk. Am I on the right track there?
Yes. So I just want to be clear, we're trying to think of different strategies to use a medical example, using a surgical knife as opposed to a broad hammer, as much as possible to scalpel, to those who know what a scalpel is, but surgical knife approach, in terms of being able to think through some strategies that still allow us to maximize opening up as much as possible and being able to enjoy those different activities, but still have some safety parameters in place to mitigate transmission.
Well, I appreciate that. And I think that's the right approach. I hope our schools, I think they should absolutely, my kids will be masked when they are masked now during the summer and summer school. I think the school board will move in that direction, but I think they're unvaccinated individuals. So it's important. Appreciate the previous questions about our staff. I hope I know you guys will follow up on that. I had questions there too. And then the last thing I'd ask about is the breakthrough cases again. So if I was reading that right, there were 100 and some odd of the 600, 100 30, I don't want to misquote it, were breakthrough cases, were cases where people were vaccinated 14 days or more and contracted COVID. Is that correct? Did I read that right? Okay. And are we still doing, the answer was yes, Dr. Gales was on mute, but just for the public, the answer was yes. Are we still doing contact tracing related to that? And is that, if so, is that leading back to anything specific, any set of activities, locations, like we used to see with, restaurants, indoor dining, we had some trends that formed. Are we seeing anything like that?
There's nothing that jumps out at the moment. I'll have to go back and take a look at it. So yes, contact tracing continues, and it continues utilizing our own staff here as well as working with the state. And we're actually due to get our weekly report from the state tomorrow morning that will provide insights in terms of particular activities. Just off the top of my head, I want to say, a lot of it stems from, larger gatherings with folks being exposed. And it's a mix of, unvaccinated folks with vaccinated. And to give a sense of the scope, we're talking about, 600 total new cases in the last month, which, to give perspective, there were days last year and earlier this year, actually, where we saw, 400 or 500 cases on a daily basis.
Right.
And when we look at that number of the percentage of, so we're talking about 100 some odd folks who have been fully vaccinated of that 600, that's 23%. When you scale that out, again, you flip the denominator. When you look at the percentage of those folks who are vaccinated, who are testing positive, that 144 is 0.00001% of the 800,000 folks who've been vaccinated. So I want to make sure that people understand both sides of that number, because I don't want folks to say, well, even see the vaccinated people still get it. That's why I'm not getting vaccinated. No, that's not what we're saying. Vaccinated folks, there's always been, a smaller risk of contracting it, but they're not having symptoms. They're not ending up in the hospital. If you are an unvaccinated individual, you still carry extreme risk of developing complications should you come into contact with it. And that's the group that we're significantly worried about that could potentially cause us to see an increase in hospitalizations and continued COVID-related fatalities.
Important point. And go ahead, Dr. Stoddard.
I was also going to add it. It is also very likely that the unvaccinated people are doing the bulk of the transmitting, even to vaccinated people as well. So not only is there the benefit to yourself, but from a public health perspective, being vaccinated will reduce your probability of being able to transmit, even if you were one of those vaccinated people who did end up contracting. So it's important to understand that this as a public health issue, not just an individualistic medical issue. Transmission is being driven by those who are unvaccinated across the country, as it is in Montgomery County.
Yeah, do it for yourself, but do it for your community. And an important point, both of you and Dr. Gales, that unvaccinated people are the people who are getting sick and dying. Vaccinated people are not, and how small of a percentage that is. All right, I appreciate it. Thank you, and for all the work you're doing. And it's because we rank first in the nation because of the work that you and your teams are doing. So really appreciate it. Thank you, Mr. President.
Thank you, Councilmember Katz.
Thank you very much, Mr. President. And again, I want to thank Dr. Gales, Stoddard, and Bridgers for all that they do on not just this topic, but many others as well. We've been doing a lot of discussions on other topics as well about marketing. And I think that we need to make certain that our marketing continues to be so we can reach, obviously, the people who are not vaccinated. And are we still, as an example, if someone calls in and says that they would like to have the vaccination in their home, someone would come to their home and do that. Are we still doing that?
Yes.
If there's an individual who has, issues being able to get out with transportation or other issues and need that, please let us know.
And I think we need to, if we can, make that very prominent on our website and on other places. If you'll send it to each of us, that we can put it in our newsletters as well, so that the people who it might not be that they're people that don't want the vaccination. They just don't know how to get the vaccination in some cases, or don't have the ability to get the vaccination. Is the we were talking about the providers themselves. Are the private physicians, do they have the vaccination now?
Yes, they do. Yes.
They do. So if someone called their private physician, then they could also receive, because there was a time, obviously, that was an issue as well. And then my final question is, when the under 12 children, is there any idea when they might have the ability to get a vaccination? I mean, I'm assuming that it's ongoing for the Pfizer's and the other people who are actually providing the vaccine, that they're continuing to do testing. Is there any idea when they might be allowed to get it?
Well, thank you, Councilmember Katz. So I wanted to clarify, before getting to that one, I wanted to clarify with the private providers. So again, in order for private providers to get access to the vaccine, it's not something that's just sent to all of them. They actually have to go through and register with the state system to be approved as a vaccine provider, which a lot of them are already, but specifically for COVID, and then they can get vaccines shipped directly to them. So if you have a private provider at home, I would encourage you to call your provider to see if they are offering the vaccine before showing up and expecting to get it. And to the point related to children, we don't unfortunately have, or at least I'm not aware of, an update in terms of the time frame. There had been hope that by mid to late August or early September that the vaccine would become available to the younger folks, but the FDA has not opined recently any updates in terms of when we expect to get that. Unfortunately, it's probably looking more to mid-fall than earlier fall when that will become available to that younger population.
Thank you for all that you do, and I'm yielding back, Mr. President. Thank you.
Thank you, Councilmember. Councilmember Rice.
Thank you very much. So first, I want to thank you, Dr. Gales and Dr. Bridgers and Dr. Kroll. I know you may not be on the line, but for promising to partner with us. Just to let my colleagues know, CVS, Aetna, in conjunction with MCPS and the health department, is looking to do a vaccination date as well as testing for MCPS's back to school. Which is incredibly important because that back to school fair involves our children, our young people that are going back to the classroom, as well as their parents and families. And so it's a great opportunity while people are out to be able to get both vaccinated as well as tested. And so from that perspective, just really want to thank CVS Aetna, as well as you, Dr. Gales, Dr. Bridges, Dr. Kroll, and Montgomery County Public Schools for all coming together on that initiative. I think it's things like that you, Chair Albornoz, Vice President Albornoz, were talking about when it comes to those creative types of partnerships that are going to be incredibly important about ways to continue to move us forward in the community. To that end, Dr. Gales, my question for you is along the lines of our students as well. As we know that this is prime time summer, our July, August timeframe is when many of our families travel. And so similar to last year, we actually asked for some guidance that I think then Superintendent Smith gave to parents and families as they were looking to travel across the world, not just throughout the United States. And so what would be the recommendations and suggestions? You've touched on it a bit, but are there places that folks should actually avoid? It's very interesting that the United States has actually highlighted some areas in some countries that actually have less transmission rates than states that are in the United States as travel advisories, which I found very interesting. Many of them Latinx countries, and I'll leave that for a discussion for another day as to why that happens. But I'm certainly curious as to what your thoughts are there, just for advice for those families and individuals who will be traveling during this high peak time, where we'll also see probably our travel lines in airports and other travel venues that'll be much longer than they've ever been before. So folks will be experiencing this for the first time in a year and a half. So what should their practices be?
Thank you, Councilmember Rice, for your question and observation. You're right. It's August. You all are going on recess. I hope you take some vacation. And, lots of people will be moving around. And so I think the first thing is, again, to continue to pay attention to reports of what community transmission levels are in respective places. There's lots of places where you can get that information from the CDC website. Different embassies have that updated information in terms of levels. The State Department actually they regularly list kind of, warnings related to the safety of particular countries, but they've also, as part of that information, also released travel advisories related to COVID transmission. And that applies to, other countries. But the CDC and other venues also continue to make information available for domestic destinations in terms of their levels of transmission. As was referenced there's a number of states, including Florida, where we're seeing significantly higher numbers that are extremely concerning. So I think the first and most important thing is to be mindful of where you're traveling. And if there is an area that has significantly elevated levels of community transmission, particularly in the absence of public health measures in place to mitigate those types of things, I would encourage folks to be cautious about traveling to those areas. And if you do, making sure that even in the absence of larger mandates or larger restrictions or requirements, do recommend that you to continue to follow those public health guidance around face coverings and other types of things, again, to mitigate the risk of transmission to you and your family, particularly if you're traveling with children under the age of 12 who are not eligible to get the vaccine. So I think those are probably the biggest ones, as well as Dr. Bridges pointed out, we have numerous places where individuals can continue to get tested throughout the county. And the recommendation would be, if you do travel to any of those places upon return home, that you get tested so you know your status and you know your family status, to potentially minimize exposing other individuals should you test positive upon return.
And Dr. Yales, I've heard that the United States is actually, and so it's good for the millions that are watching at home to understand some of the regulations that are out there. There are certain countries to where the United States actually is mandated that you must have a negative COVID test before you can actually even return into the country. Can you talk a little bit about that, about coverage, about how that works? Let's say that a family, doesn't have healthcare coverage, those kinds of things. How is it paid for? Are they able to do those kinds of things? Are those things that folks should be prepared for just as they're about to leave? Knowing some of this will be incredibly helpful. We hate to hear stories about folks that may be stuck at the border, not being able to get back into the country.
Sure. So the U.S. actually requires, regardless of where you go, regardless of the country, anyone coming back into the country to have a negative COVID test within 72 hours of returning. So this is regardless of where you're going on the globe. It's required to come back in. Many places have set up different testing provisions. So a lot of countries have private providers that you can access, private labs. I know a number of hotels and resorts in different places have included a testing option or made a testing option readily available to their residents and folks who are staying on their properties. I believe that in many instances they are paid for out of pocket in a range of services, from being able to go to a pharmacy and getting one for $25 to $35 to getting a more private rapid test that may be several $100s. I also, from my understanding, believe that a number of airports have made testing options available for folks who are flying in and out. And so what I would encourage folks to do is, if you are traveling out of the country, is to do your research and identify places that you can get tests before you leave, and to contact those places so that you understand what the costs are. And there's an extensive list of the types of tests which are acceptable upon return, and making sure that the tests that are offered in those places match up to what is an acceptable return. And the way it works in many instances is, as part of you flying back into the country, the airlines have different software that allow you to upload your test results, and they will be able to confirm that it meets the requirements, confirm that it's negative, and allow and give you some level of preliminary clearance so that you actually can board the plane and come back home. And so, again, do your research before you leave to make sure that you know where to get that done, you know how to pay for it, and in instances where insurance may cover it, that you're able to get that information transferred to minimize the financial burden to you and your family.
So, Dr. Gales, thank you very much, because you're not hearing this on media outlets. They're not talking about this, and this is really incredibly important as folks look to travel. So thank you for giving the guidance for folks, not only when it comes to how to best keep themselves safe, but then also to ensure that they are adhering to some of the mandates that are before us. I'll just close with one last thing that some of my colleagues have touched on. And look, no one wants to feel as though we're penalizing those who have done the right thing by getting vaccinated, by following many of the guidelines, continuing to minimize the risk. But the reality is that we all have that shared responsibility to keep us all safe. And so from that perspective, it's oftentimes seen as though the people who are doing the right things are oftentimes the ones who end up sacrificing. But that's true when it comes to pretty much everything that's out there. So what do you say, and what is your message to those who have, done what they're supposed to? They have their entire families who've been vaccinated, but who still struggle with the fact that, there could be at some point another mask mandate that's there that, on the horizon that continues to impact them when they feel as though they've done everything that they should.
I'll be perfectly candid. This is a tough one for me to answer in my capacity as a health officer, but also my capacity as a private citizen. This is tough. We have created, so I'll, as the health officer sitting in the Board of Health, I'll answer it from the health officer perspective. We have been fortunate to have a tool that's effective at keeping people safe, that allows us to be able to move forward and reopen society and return to schools, return to business, return to work, return to all of those things. And it has unfortunately become very politicized in terms of an issue of civil and personal and individual liberties and the influence of government, which is extremely unfortunate. And it has caused a situation where there is this huge deluge, if you will, of misinformation. We've even had the Surgeon General, the U.S. Surgeon General, come out and talk about how dangerous misinformation is, because that misinformation has led people to make uninformed choices that have put their lives and others at risk. I think in last week's session, we talked about, Dr. Stoddard mentioned the case of the physician in Alabama who shared stories of folks who were anti-vaccine or against it, or believed that COVID was a hoax, who were in the hospital and about to be ventilated, asking and requesting for the vaccine, and then being too late at that point. And we've seen numerous, news outlets go back and forth in terms of the information they put out. This has to stop, because this is, it's just unfortunate that we are in a place where health information and science have been politicized and uses a political football, and it's put people's lives at risk. And when you put people's lives at risk, that's irrespective of political affiliation, race, ethnicity, geography, age, gender. And that's unfortunate, because we want to keep people healthy regardless of all of those things. Now, to those folks who have done what we've asked them to do, we ask you to continue to be patient, because ultimately at the end of the day, any of the guidance that we put forward from a health perspective is strictly from the lens of trying to keep you and your family safe. And we're hopeful that we don't have to put forward or recommend to you all to take further action on any of these particular instances. But we have to think about what's going to keep you and your family safe, particularly the kids who aren't eligible to get vaccinated. And particularly as we want them to get back to school and want them to get back integrated into society, we want to make sure that they can do that as safely as possible.
Thank you, Dr. Gales. Appreciate it. And back to you, Mr. President.
Thank you, Councilmember Rice. Councilmember Glass.
Thank you very much, Mr. President. I appreciate the question that Councilmember Rice just asked regarding travel, and appreciate the doctor's suggestions there, because next month in August, I'm going to be getting on the plane for the first time in, I guess, years now, 2 years or so. And I'll be visiting my in-laws in a community that has substantially higher rate of infection than we do here. It's a different type of community in a different part of the country. And, you know, they watch different types of media than we might hear. And, you know, that segues into the question that I've been thinking of listening to this presentation, because earlier on, when I think it was Dr. Gales, you had shared the information about the zip codes, that the infection rates of those zip codes. And we here in county government have put a lot of focus on the equity emphasis areas and trying to make sure that all of our communities, especially our communities of color, received vaccinations, received COVID tests, and all of the support services that they so rightly deserve. And we've been working really hard in that effort. And the proof is that our Latino residents have a higher vaccination rate than our white residents, right? And so the work that we've been doing collectively as government has been showing signs of success. And so taking that even one step further with regard to the zip codes, according to the CDC data that was shared, 91% of county residents over the age of 18 have received 1 or 2 shots. And if you think about that through a different lens, 91% of individuals of voting age have received 1 or 2 shots. And here in Montgomery County, in the last election, 79% of Montgomery County residents voted for President Biden and Vice President Harris. And so clearly we have some very smart residents who are listening to the science regardless of their political affiliation. If you look at that spread between the presidential election and the overall population here. And so the point that I'm trying to raise is, if we look at the zip codes, do you see a correlation between party affiliation and the way people have voted with regard to the vaccination rates? Is that a level of analysis that we've done?
Thank you, Councilmember Glass, for your question. I am not aware of that level of analysis on that one. I'm sure we could probably look into that, but I don't at this time have that data available.
Sure. So then I'm getting some real-time communication from folks who are interested in that data. Where is the census level data? The zip code level data that you shared? Is that public on one of our websites, or would you be able to pop that back on the screen so that I and others can take a screenshot of that, and some of our incredibly smart residents who love data can do some of that computing?
Sure. I believe we post the pulse reports that show kind of the percentage of residents vaccinated. The Excel spreadsheet that I showed is not on a public site. I can share that with you all after the conclusion of the meeting, and email that to you all to be able to share with your residents. And I'm just thinking in terms of, we would not have, at least from the health perspective, we would not have a breakdown or access to kind of a map that showed political affiliation. We would just simply have the epidemiologic and surveillance information related to the rates for those zip codes.
And I think you're right. Well, you are right about not doing that level of analysis on your end. But seeing what some of our residents do and the sleuthing and all of the data that is available on various resources here in the county. I think that's something that others will pick up, and as they've been expressing to me in the last few minutes or so, I think they'll do that. So we can follow up on that, or everyone can just rewind to the beginning of your presentation where you shared that zip code level data. So that's all good. The other thing just that I want to re-up regarding the data, I think in a previous Q&A with one of my colleagues, Dr. Gales, you had shared the percentage of individuals who've been vaccinated who have now, for lack of a better term, relapsed or gotten COVID a second time and might be in the hospital. What was that percentage again? There were a lot of zeros in there. Point to the 1,000th degree or 10th.
Sure. So the number that I presented was looking at the number of new cases in the last month of individuals who've tested positive who were fully vaccinated divided by the total number of folks who've been fully vaccinated. And so using 144 as the numerator and approximately 800,000 as the denominator, that came out to 0.0001%.
A really important number. And I just wanted to make sure that I got that correct and that everybody who's following this conversation understands how rare this is, but a rarity that we are not taking lightly, and that we need to make sure that we continue stopping the spread and doing everything that's available to us to keep all of our residents healthy and safe. But it is quite rare that is occurring here in Montgomery County. So appreciate you doing that back of the envelope math there. And then, just to summarize, I appreciate the efforts that have been done at this time and the urging of us to look ahead, seeing that this is ongoing and that the numbers are trending in a direction that we might not like, but it is still at this point quite manageable. So if we take those extra steps, we can try and nip this in the bud, but it'll take all of our efforts. And again, I appreciate this. And as the Council Vice President said, this might be the last public update we receive for a number of weeks, but we are all here ready and able to jump into action should the data and science dictate otherwise. So thank you all very much. And I hope you get a few weeks of rest as well over the next coming weeks. Thank you.
And I just wanted to, and getting real-time feedback as well, Dr. Liu, our epidemiologist, informed me that the vaccine rates by zip code are a part of the county dashboard. And so residents can see that map that shows the percentage of vaccine uptake in the respective zip codes.
Beautiful. Thank you very much.
I would only note one point, though, that just make sure we're clear. The CDC tracks about 90,000, a little less than 90,000 doses of vaccine that we actually probably don't have zip code data for. So as you look at the charts that are on the webpage, those are the charts that are in the state Immunet system, which will obviously give us more. So like some parts of the county may look lower than they actually are because they're proximal to the district or other places where they may be getting vaccinated. Through means that we don't have a zip code score for. So just, as we look at this, I think it's great analysis. Just remember there's a fair chunk of people who are not accounted for in that chart.
And that has been the discrepancy in the dashboard from the beginning, which I know we've all been getting questions about as well. So thank you for articulating exactly what that discrepancy has been. Appreciate it. Thank you very much. I yield back, Mr. President.
Thank you, Council Member. Council Member in the bottom.
Thank you, Mr. President. I don't get tired of pointing out the data point regarding the vaccination rates in the Latino community, because that was such a heavy lift and something that we all need to be very proud of while we continue to, do whatever we can to make sure that we hit that same exact milestone for our Black community. But all the credit really does go to the team and also to the community for responding and for really coming forward and for not buying into all the misinformation and disinformation that has been alive and well. And so that is such a wonderful piece of good news. The one piece I wanted to ask the team had to do with boosters. You know, folks are still wondering what is the latest regarding the need for boosters, especially as breakthrough cases, you know, are a thing in the media, and folks are just wanting to make sure, do I still have enough immunity? Am I covered? Am I okay? You know, all of those questions that go through people's minds as they're trying to discern this, how to mitigate the risk. So can you talk a little bit more about that? I know that, you know, for the latest I remember hearing was that there wasn't a need, but any updates that we can communicate to our constituents?
Thank you, Councilmember Navarro, for your question and update. So as of this morning, there is no new information regarding boosters, other than to say the information that we have so far from the FDA and the CDC suggests that those who have been fully vaccinated do have appropriate immune protection in terms of having appropriate levels. At the time, they have not put forward any guidelines or suggestions that the conversation around boosters is imminent. We continue to use our term from earlier contingency plan in the event that that decision will be updated in the future, and that we will be able to provide resources to our residents to get those boosters if and when that happens. But unfortunately, at this time, there is no new update from the previous conversation.
The only thing I will add to that is, while CDC and FDA have not acted, I think Dr. Fauci made the news on Sunday, as he can typically do, saying essentially that he thinks it may be likely that if there is a booster, it will focus on immunocompromised and older residents. There is no announcement that a booster is needed at this point, as Dr. Gales alluded to, but he did make the news on Sunday saying essentially he thinks that he said he thinks it's likely, and I'll put that in quotes because I'm looking at the quote right now. He thinks it's likely that it will have to happen sooner or later, that immunocompromised and older adults will be asked to get another booster shot, but that is not at this time recommended.
Thank you. I'll close by saying that, you know, especially in a county like ours, where you have such a high percentage of immigrant population, it is not lost on those of us that have family members or friends who are still back in other countries who have not had access to the vaccine, how fortunate we are here. Our family just lost a dear friend literally 24 hours ago because he did not have access to the vaccine, and by the time was flown to the United States, it was too late. And so for those people who are continuing to believe the misinformation and disinformation, just know that there are others who would love to have the exact type of access that we have here. They don't, and unfortunately, it costs their lives, and it causes a lot of pain to those family and friends, and so, you know, just wanted to share that, because it is quite a interesting time that we're living through, where all of this type of politicization of something so important like a life-saving vaccine, where other people are literally losing their lives hoping that they had that access. Thank you.
Thank you, Council Member. Any other requests to speak? If not, thank you all so much for all your great work. I echo Councilmember Glass in saying that I hope you get a little downtime as well over the next few weeks. And Council Vice President Albornoz reminding you that we're happy, while we don't have a scheduled meeting right now, we're happy to reconvene as necessary if we're called back to respond to a surge in cases. So thank you all for your good work. Stay in close touch with us.
Thank you, and take care.
Thank you.